Hi. For those of you who don't know me, I'm Polly. I'm one of the charge nurses in the emergency department downstairs, and I am with Liza today. And my 2017 goal was to try to help bridge the gap in our vascular access needs, meaning sometimes our vascular is not available, and we've been having a lot of struggles with the availability of nurses that are competent in doing access. So throughout 2017, we're going to try to get all the charge nurses trained in vascular access for their patients so they can be the next person to come to. And today I'm going to help show you how to do it. So we're first going to talk about what size equipment you need and what equipment you need for when you're going to go do an IV. There are 4 different types that we typically carry. We have the shorter 24 that is good for the newborns, probably like up to 6 months, meaning the catheter on it is just a little bit shorter than the longer 24. It also you can see it has a little bit of a winged tip, which makes it a little bit easier. It sits up against their skin a little bit nicer, and you don't have to place a Band-Aid underneath that one. So shorter, good for kids with small hands, maybe some of the more difficult immunosuppressed type patients. This one's a little bit longer. I would use this one for anyone who's over 6 months to maybe a year. You could maybe even use it up to 2 years. Just depends on what kind of patient you're looking at. The 22 is blue. That would be appropriate for anybody who's 1 year or older. I think most of our nurses probably use them when they start to turn 2. Good up until adolescent type ages. If you don't need a large volume at a time. The 20 is the pink one. This one is good. Anybody who's an adolescent should have 20 in, or that would be the most appropriate size for them, understanding that some of our kids are quite complex. So if it's just access you need, you don't have to go big. But this one, if you need large volume for anything, would be the best for adolescent or older. Liza is almost 8, and her veins actually would be most appropriate for a 20 as well, because they're just very large. You're also going to get your catheter set, tubing, which is just that. You want to grab a J-tip. J-tips offer just a pressure-infused buffered lidocaine to the site of where you initially poke, which helps with the flinch factor. Yes, they might cry and scream because that's loud and scary. However, when you go to poke, it numbs that spot up so well that they don't actually feel it, and they won't have that flinch factor. You'll have a better ability to get in. One thing to note with the buffered lidocaine is it has the ability to break capillaries. So if they are low on platelets or have a anticoagulation issue, you're not going to want to use it for those type of patients. Your chlorhexidine, and your Tegaderm, tourniquet, flush, tape, and your gloves. So to just get started, if you're just putting a line in, you're gonna line all this stuff. So Liza, we talked about this earlier, we're gonna go ahead and use the blue 22. And we're gonna get this ready, chlorhexidine ready. Squeeze these together. I know you probably know that already. Give it a good shake. That mixes it well. Tourniquet, your flush. Sometimes it helps to get this stuff already away from the patient so they don't see you doing it. Makes it a little uncomfortable for them seeing you prep sometimes. I would just loosen this a little bit because it's hard to get off sometimes. Put that aside. And then just different sites. You're gonna want to get this ready too. Okay, so for Liza, it's nice to put the tourniquet on their clothing. So you put the tourniquet underneath, up against their skin, and you want to pull from both sides. The reason behind this is if you pull from one side or the other, it actually pulls their skin, it hurts really bad, so then they're already crying before you start. So pull tight from both sides, loop one underneath the other. That way you have a quick release for when you're done. It'll come right off. So once again, up on both sides. This will help fill your veins a little bit. You look at Liza's hand. She has already a nice straight one right here. That'd be perfect. You could potentially put 20 in that one. She doesn't need large volume right now, so we're going to use the 22. You also have a nice forearm vein right here that you can, I don't know if you can see that on there, but it's plump and full. You can actually feel it with your fingers. Coming in from the middle, her anicube, very nice, big. Watch out for these bifurcations right here where they come together. They typically have valves in there, so you would want to stay away from the actual bifurcation part and go either above or below that site. And then another rule of thumb is, what's the length of your needle? So let's see here, this one kind of curves right here, right? So maybe you wouldn't want to start here because then your catheter has to go around this loopy part. You just want to try to find a spot that's the best straight line. It will help save your site a little bit longer, cause less irritation. Okay, so here we go. Let me see here. J-tip. Get this ready. You have to push that orange piece down, which can be challenging at times. No needle on there at all. And put that here. You're going to use your gloves. Okay, scrub, 30-second scrub, here we go. You want to cover anything that's going to be underneath that tegaderm. So you want to scrub, scrub, scrub any spot that's going to be underneath that tegaderm to help prevent any infection or phlebitis or anything like that. The J-tip. So these are pressure infused, and what I found works the best is that I make a spot over where I would like to go, and it leaves a circle. And then you do the same thing as like an IM injection where you Z-track it and pull it over to the left or to the right of that site. And then you go where that mark was. 3, 2, 1, it's gonna be noisy. Jump factor, see? Okay, now you can see here on the video, it left that circle. That's the only spot that actually has lidocaine in it. If you go above that site, it's gonna hurt. You go below that site, it's gonna hurt. You have to go right in the middle. And it's lined up right over top of the vein, so that'd be the best spot to go. Now, Liza already talked about this. She doesn't actually want to be poked for the video, so we're not gonna actually poke, but I'm gonna walk you through the hand techniques that are gonna give you the best control and safe for the patient, and hopefully only have to do it in one try. All right, so when you hold the IV, you want this finger, your pointer finger on top. You want the thumb on the left and the middle finger on the right. The reason is that the only spot that this you can see, your flash is actually way back in here. So you won't see it in the hub anymore. They got new catheters a couple years ago. You only see it right here. So if you're holding the tip with your finger, you're occluding your site. So you won't actually know when you're in. So like this, I always train. And the other thing is that when you go in, you have to pull tension on the skin. If you let go of that tension, it hurts. You're pushing against her skin. It's likely just going to cause more pain, and you're not going to get in. So you hold tension off to the side, keeping in mind, no, I'm not going to do it. Okay. Keeping in mind that when you come down to drop down, that your thumb's not in your way. So you have to hold it, however, it's not going to be in your way. Sometimes it's best to hold from the knuckles and pull down. That way it's going to be out of your way. So with her, I'd start right here, thumb, pointer fingers out of the way, go right in that circle spot, and you go until you get flash. The flash is going to show up way back there, okay, way back in here. Once you get flash, you have to lower your needle, and then you still have to go a little bit further in. The reason for that is, you can see the catheter is shorter than the needle by a little bit. These catheters are great for kids because they don't cause as much irritation on the inside, but they also don't have the strength to push through the vein on the outside of the vein. So therefore, your needle and your catheter have to be fully in the vein before you go advance. Otherwise, you're just gonna make a circle on the outside of the vein. Okay, so there you go. So now we're down. We're in the vein. We had advanced a little bit. You're gonna take your pointer finger and you're gonna flick, 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 flick. All the while holding tension with your hand, never, ever, ever, ever letting go. You're gonna hear a click. That's your key to when your needle is safely in outside of your hub. So now it's clicked, it's inside, you won't get poked when you remove it, okay? Still don't let go of her hand. You're gonna use your middle finger up here, and this is where you'd go and occlude the tip of that catheter so that doesn't bleed when you take off the hub, okay? When you remove the set. These two come off, and they're gonna go to each side and remove. So there you go. So now you shouldn't be having the back full of blood coming out because you're occluded on top. You also are ensuring that your hub is secure because you haven't let go yet. You still have control of this IV. This one, so now you've loosened it a little bit, should be able to come off. You attach it here, and then you're gonna flush. Sorry, you're gonna get a little wet. Okay?
Okay.
Perfect. This is a tegaderm. I should have had this opened. If you look at our tegaderms, it has strips on it. There's a reason for that. The little teddy bear strip should go underneath the hub site, and that's because they've been finding that the actual hub is causing ulceration under it if they leave them in too long. So we take that little middle strip. This is the tricky part. You have to make sure you get underneath and you don't let go. Don't ever let go. Okay, that goes down. See, it's all the way underneath here. So that way provides good skin protection. Then the rest of it, you take that off and you're gonna put it over top. At this point, I still would not ever let go. Okay. All right. Now that securely fastened here. Want to get that all down so there's no spots. Now, just make sure you still don't ever let go. At this moment, you're going to think you're good and everything's fine. Release your tourniquet. However, that other arm over there gets a little wild at times, comes and reaches over and pulls it right out if you let go. Or your holder's decided that she's going to try to help you tape, and they let go, and then something goes flying, or the flush is so heavy that it pulls it right out, because some of those 24s are really light. So just be mindful that your finger should never let go of this until it's all the way done. So I like to put tape underneath here and come up on either side just to kind of give that hub some support upward in case they're extra wiggly. Okay. Another one on top. And you'll probably find your own technique for this too, but this is just how I recommend. Make sure that you cap this off, clamp it off. Another one here. There you go. Cover it with a no-no, or she's 8, almost 8, so she'd probably be fine to leave it, but you have to ask the parents what they think is best. One other thing that I want to touch base on is that your vascular access is probably only as good as your holder, so that when you go and find someone to help you with this, I would say that even if they're a little nervous, or anybody who is under 8 years of old, even 8-year-olds, even up to teenagers, sometimes they just need someone to remind them not to move. But make sure your holder understands that they have to hold the entire time and that they are not to let go until it is completely covered with no-no and taped down. That will be key to your success. So there you go. Throughout the year, we're going to try to be putting on classes so that we can try to increase everyone's skills on placing IVs in their own patients so that we don't have this lag time anymore. So I hope to see you at one of my classes. I'll let you know when the dates are.